thank you to colleagues for giving us the time to be able to showcase the work that I can take no credit for, but my team and colleagues are doing in relation to health and wellbeing of our staff, students and service users across Wales. As the chairman said, this has never been a more important piece of work, and we're really pleased to have been able to lead this on behalf of NHS Wales with our partners over the last few months. So looking forward to a really interesting, exciting presentation. I'm going to say no more, but just a huge thank you to Phil and to Claire, and over to you, please. Thanks.
Brilliant. Well, thank you, Chris, and thank you, Julie. It's a huge privilege to be here and to be able to present briefly on this topic and to have some have some discussion about it as well. So just to introduce myself and to Claire, I'll introduce myself first. I'm Phil Bushby. I'm the strategic program lead working within HEIW, and one of the roles that I was asked to do during the early months of the pandemic response was to chair a group that was looking at the health and well-being of our staff across the health and social care networks. And I'll talk a little bit more about that before I hand over to Claire to talk more specifically about some of the products. So Claire, perhaps you can introduce yourself and then I'll go through the first couple of slides.
Pnawn da, diolch Phil. Claire Smith ydw i. Rydw i wedi bod yn gweithio yn yr NHS am 20 mlynedd ac yn lles a Iechyd y gweithlu am 5 mlynedd. So good afternoon everyone. I'm Claire Smith. I've been working in the NHS now in Wales for 20 years and for the last 5 years specifically in staff health and wellbeing. Thank you.
Brilliant. Thank you, Claire. And if you could take us on to the first slide, that'd be fantastic. So there is a huge amount of academic research that supports some of the work that Claire and I have been doing, and this abundance of evidence. There's a couple of the links there that we've put at the bottom of the slide. And I think these slides can be made available afterwards, which underpin a lot of the work that we're doing there. And we know from this work that the views of staff views of their leaders has a real impact on the care and the quality that patients get. The staff satisfaction has an impact on patient satisfaction. The high work pressure leads to less compassion. The poor staff well-being can lead to poorer performance, but good practices can lead to lower patient mortality. And those truths are linked and are there in evidence. Claire, if you could go on to the next slide there, please. And what we know is that as well as some of the things that Claire will talk about a bit later on in terms of some of the products that we've worked on, we know that the fundamental importance for a member of our staff being well at work and having good well-being at work is the relationship that they have with themselves, with their managers, with their peers, and with the organisation that they work in. And some of the work that we've been doing is trying to make sure that as NHS employers in Wales, that we can be as good as we possibly can be to make sure that the fundamentals for somebody coming to work are as good as they can be. And we know we're not always going to get that right, but we need to recognise that it is the relationship that an individual has with their work, with their peers, with their managers, that is going to really fundamentally have the impact on how they are and who they are at work, which is really, really important. Claire, if you go on to the next slide, please.
Sorry, I've lost my mouse. There we are.
So one of the things to talk about is the workforce cell, which we've put up there, the health and wellbeing subgroup. So this is the work that I mentioned at the start. In that, in the early days of the pandemic, we recognised that health and wellbeing of our staff, of our service users, of our patients, was going to be more important than ever. And Claire, move us on to the next one, please. Because although health and well-being is mentioned in lots of our strategic documents, and you may be aware that the workforce strategy has been published during the pandemic, actually, and that was work that was done by HEIW on behalf of the NHS and Social Care Wales, and really has some of these themes around health and well-being enshrined in there as a strategic response. But we recognise that during the early months of the pandemic that we really needed to consider how we were supporting staff, what we could do to support staff, and make sure that we could do things as well as we possibly could. And so one of the things that that we did was to bring this group together, and this group was a member of a range of people from a range of professions and organisations. So there were people from Welsh Government, from the NHS, from Social Care Wales, from academia, from trade union bodies, and a range of people came together, and from a range of professions. So whether that was from a wellbeing background, an HR background, clinical psychology background, that we came together to really consider things. And we did a few things in this group. We recognised that within the 11 employers within the NHS in Wales, and also across Social Care Wales, there were a number of really good things that were there already. And so we pulled those things together, we considered them, and then we made them available on the HEIW website, which Claire will talk to us a little bit more about in a couple of minutes. And what we also did was think about when things were needed to be bought once for Wales. So when those things didn't exist or were patchy, that we bought things once, and then we're able to offer them out across the NHS and across the social care network as well. A couple of examples of that would be when we considered the Samaritans and developed a specific service with them for NHS workers, and also took some computer-based therapies such as Silver Cloud, and again made them available across the whole system. So an opportunity to share best practice within that group and to make it available, but also to think about whether things were missing, to invest in them and to make them available once for Wales. So Claire, perhaps you could move us on. And really that's the sort of the bigger picture that I wanted to share in the few minutes that I had. And I'll hand over to Claire now, who will talk us through some of the specific products that we looked to invest in and develop and make available. So Claire, over to you.
Thank you, Phil. So what you see here on the page is what we call our pyramid of support. And as you can see, it's got different levels and different colours. The blue sections at the bottom is very much what Phil was talking about earlier, and that's the importance of the relationship that our colleagues have in their local team and with their direct line manager. And we've got fantastic health and wellbeing local organisational support across NHS Wales in the 7 health boards and 3 trusts and the Special Health Authority. So I wanted to really go into how important it is for staff to access this support locally on their staff intranet sites. And what I'm going to do, just a second, I'm going to stop sharing, and then I'm going to share our HEIW website that we've pulled together so that all the resources are in one place. So excuse me a second while I stop sharing. So I'm going to share again, so I'll be able to show you how you can access this yourself. So share screen. Okay. So this is the HEIW website, and there's dedicated COVID-19 information and support. So this is your normal landing page. If you click here, that takes you then to the COVID-19 pages, and it's extensive, and this was pulled together very, very quickly by staff from across HEIW. So what I want to bring to your attention today is the staff wellbeing COVID-19 pages. So as you can see, right at the top, we have here a link to all the health boards and Social Care Wales. So if we click into that, as a member of staff, then you can see which health, you should know which health board you work for. And then you can access by clicking on these links all the way through. It'll take you directly, so for example, with Hywel, to your occupational health page, the wellbeing page, and the external wellbeing page. So some of these pages you can access from home, from your mobile device, some of which are internal and you can access from when you log in as normal into your computer laptop. So again, I just want to say that there is a network of health and wellbeing experts, managing attendance of work and occupational health. And they work extremely hard and are very experienced and pull together all this information. But we wanted to provide a one-stop shop for all our staff from across NHS Wales. So then, as you saw, the pyramid of support at the bottom was blue, and that was local. The next section then was HEIW. So each organisation has its own, like I've just mentioned. And then the section at the top, which I'll go back to, is the pink section, and that's the national products that we've pulled together. So just a couple of the ones I wanted to show you. So if I go into the helpline here, and as you can see right at the top, we have the Samaritans. And what we did as a subgroup of the workforce cell was submit a proposal to Welsh Government for funding for a dedicated Welsh line. So that line is available to health and social care staff. It's manned by trained volunteers, and actually the dedicated number for NHS and social care has got staff involved who understand, you know, what it's like to work on the front line and what it's like to work in a health and care setting. So there is an English line, but there's also a dedicated Welsh language line as well. So that if Welsh language is your first language and you prefer to speak in Welsh, you can do so. Also, again, on these pages, we've also brought together some of the resources that are available, like Able Futures, which is a Department of Work and Pensions funded initiative, and then Health for Health Professionals, which I wanted to tell you a little bit more about. These used to be available for medical workforce. It's now available for all NHS workers, students and volunteers. It's available 9 to 5, and it can be accessed via a telephone or their website. And what this does is it provides self-help, which is various materials, platforms and mobile app, self-help guides and virtual groups. There's peer support, providing emotional support. And then there's guided self-help, such as Phil mentioned, Silver Cloud. This provides up to 8 sessions of cognitive behaviour therapy with an accredited therapist, and access, if needed, to PTSD service. There's also a link to ensure that any high-risk cases, the Health for Health professionals, doctor advisors, will be able to access expert clinical advice from a psychiatrist. And the local crisis teams and the GP practices across Wales have been made aware of this extended service. So it all links up if it becomes a higher level intervention that's required. And then, as I mentioned, with regards to Silver Cloud, that is now available to all NHS staff. Social care staff also have access to it, and it provides programs such as sleep, stress management, and resilience. And there's a dedicated Wales code there to get straight in. But what I wanted to say was that I recently attended a World Health Organization webinar. And I'm very keen to attend all these sort of UK and worldwide webinars to make sure that NHS Wales is at the forefront of anything new, anything innovative. And what was really reassuring was that everything they said that you need to do and need to provide, we have done that and we have that. So we've acted like a professional curator, because the landscape at the beginning of COVID-19 was that we were getting offers of support, and it was becoming quite overwhelming for staff. So we were able to provide a one place of good quality and relevant information at the touch of a button. So let me just stop sharing and I'll take you back to the pyramid of support. Share my screen again. So there are a couple of other resources I've highlighted here, which we also provide access to, such as Mind, Call, and Money Advice Service. So the pages have themes to them. So we have a trauma theme, bereavement, suicide, domestic abuse, and these are just some of the other resources that we've highlighted. And we've got a dedicated email inbox as well, if anybody wants to contact us. But I'd just like to say thank you on behalf of Phil and I, and we're ready for questions.
Hello?
I can hear you, Chris.
Yeah. Oh, I am working. Thanks, Claire. Thanks, Phil. I mean, each time I hear this, I hear something new. And it was very useful to see the way that you can actually see you go through the website. When you presented to the All Wales chairs the other week, they were, I think that was an eye-opener. They were very impressed. Are there any questions from people? I can't see, all I can see, now I can see people. Are there any questions or comments from people?
Chris, it's Ruth.
Yeah. Ruth, hi.
And this is so good to see, and well done for all the work bringing this together. But just wanted to ask if we're beginning to get any information on the uptake and the usage. Do we know whether, or any feedback on how people find it?
Yes, so that varies, to be honest. So we do have uses and take-up figures on some of those national products that Claire was talking about. So Silver Cloud and Samaritans and some of the others, health professionals. We understand those take-up and usage. We've also been talking to the individual organisations to make sure that we can, or try and get a consistent way to see how those services are being taken up as well, because there are local services, local EAP, employee advice programs that are in place within each organisation as well. So so some of the national products we do understand, and we talk to the organisations about those and what we're seeing coming through, and we're trying to understand better what's happening locally as well.
Well, I think it'll be really helpful over a period of time to gain an understanding of what people particularly value, and where, for example, a locally accessible service is something that people find really, really comforting, rather than a national body, or those sort of things may emerge over time, and it'd be really, really good to try and see what the story is.
I think that's right, Ruth, and I think over time is probably the key phrase, because what we do know and what we saw probably from our own experiences is that during the initial response there was a lot of adrenaline and people responding to the pandemic, and I think it's going to be the importance of support over time, both the formal stuff which we've talked about and some of the informal things that are on Claire's pyramid, and we're talking to Chris a little bit about before we went live, was that those informal catch-ups, the importance of that catch-up and a cuppa, which was a bit lower down on Claire's pyramid, which are going to be really important as well as we go through this.
Oh, thank you very much. That's absolutely great.
Jill?
Yeah, thanks, Chair, and thanks ever so much for that presentation. It was great, Phil and Claire, really, really good stuff. You touched on a couple of things I just wanted to pick up. You said that it covered social care, and I was just interested really to know how they access. Do they go through Social Care Wales? Because the first slide, I think, talked about the different health boards, so it didn't. So I wasn't quite sure if they went through that way. So I'll stop there.
Thanks, Jill. At the bottom of that page, so you had all the health boards and the trusts, and at the bottom was the link to the Social Care Wales. So we've been very fortunate to have Social Care Wales colleagues working with us on our network. And I attend their monthly health and wellbeing network meeting as well. So yes, so if you work for Social Care Wales, you just scroll to the bottom of the page and there is a link directly to their health and wellbeing intranet.
Can I just pick up the wider sort of communication, I suppose, then, because I was thinking more of a sort of, say, a care worker in a sort of a privately owned residential care setting, and indeed right across the NHS. How do people know about it? So if you're a sort of frontline worker, you know, sort of in a hospital or in a care home, how do they know?
So with Social Care Wales, they've got a communication strategy that they're developing, which will be able to detail how they're going to do that and how they are doing it. With regards to health boards, each health board has its own communication plan with regards to staff health and wellbeing. So it really depends, and each one is different. So some are all Wales, some are geographical, like in Iron Bevan, Public Health Wales is all Wales. So their communication plans should be specific to the needs of their particular workforce.
Okay, thanks. That's really helpful. I'm trying to get at the sort of reach, you know, and how sort of, you know, we don't miss that opportunity, I suppose, for people to access what they need. So did you say Social Care are developing? So they haven't rolled out, they're developing. Is that right, Claire? Did I hear you right?
I have seen a draft of their communication plan.
Right, okay.
I can also help you with the comms.
Sorry?
I said I can also help you with the communications element, because Claire has shared the link with all the resources with the health and wellbeing networks across Wales. We've also shared it with the health board comms team, so it can go on their intranets as well. And we also regularly share the information in our stakeholder updates and across social media. So when it's out on social media, it's open to anyone really to click on the link on the external websites. And, you know, we're happy for anyone if it helps them, regardless if they work in the NHS or social care. If reading some of the self-help information that we've linked to helps them, we're really happy to support.
Thank you. Can I just pick up?
That's really helpful.
Jill, just to say as well that, for example, Swansea Bay have over 300 what called sort of champions, health and wellbeing champions, and they have away days and regular workshops with these champions, and these champions are right across the health board, and they use them then as a system and a network of comms. So it's not just coming just from the website, just from the intranet page. They use those sort of word of mouth, foot on the ground type of thing as well.
That's really helpful, Claire. Thank you.
And I know in terms of the social care communications, as Claire said, we saw some of the material that Sarah McCartney from Social Care Wales was developing and putting out there. So we know they had developed that. So I think the reach is quite extensive, but I can certainly follow up with Sarah and check that for you, Jill.
Thanks, Phil.
Just one other thing as well, Jill, just to let you know that I'm working with Health for Health professionals and Able Futures on how we ensure that all this information is available in GP practices. So not just for the staff that work in the GP practices, but also if you are a patient and you're sitting in front of your GP and it's recognised that you need some kind of support, whether it's Silver Cloud or Health for Health professionals, that the GPs know that as an NHS employee, you can have access to that. So we're trying to get it to the patient level as well, but we're linking in